This tiny white powder costs pennies, but what it can do for your health is priceless. I'll never forget one of my patients, an 82-year-old widow named June. She came into my clinic with persistent skin irritation on her lower legs. Creams hadn't worked. Prescription ointments had failed. But what finally brought her relief? A simple soak in baking soda and warm water, something her grandmother used to do. And that's when I started paying attention. Because for too long, baking soda has been dismissed as just a baking ingredient or a fridge deodorizer. But the truth is, it's one of the most underrated natural remedies sitting quietly in millions of homes. From kidney support to heartburn relief, skin care to oral health, its reach is remarkable and backed by real science. Have you ever used baking soda for something besides baking? Let me know in the comments. I'd love to hear your story. In today's video, I'm going to walk you through 13 powerful, doctor-approved uses for baking soda that can benefit seniors especially, plus a few critical warnings for who should avoid it. Every use is backed by research from respected journals like the Journal of Immunology, JASN, JADA, and more. And I'll be honest with you, I was skeptical at first. But once I reviewed the studies and heard what world-class researchers had to say, it changed my thinking entirely. If you're looking for affordable, natural support for your health and want to use it wisely, not blindly, this video is for you. Before we dive in, I'd love to hear from you. Where are you watching from today? Drop a quick comment below and feel free to ask any questions you might have. And don't forget to hit that subscribe button and turn on the notification bell so you never miss a video from Be Healthy Seniors, your trusted source for evidence-based, heart-smart health tips. If you're watching right now, let me know you're here. Type 1 in the comments if this message speaks to you, or 0 if you're still deciding. Either way, you're welcome here. Let's move to number 1. When most people hear the term alkalizing, they either picture trendy wellness influencers or overly simplified health myths. But here's what the real science says. Your body tightly regulates its pH balance through complex systems involving the lungs, kidneys, and cellular buffers. You can't radically change your blood pH through diet, but you can support your body's ability to manage acid buildup, especially as you age. This is where baking soda comes in. In 2009, a landmark study published in the Journal of the American Society of Nephrology, JASN, revealed something astonishing. A daily dose of sodium bicarbonate, just plain baking soda, significantly slowed the progression of chronic kidney disease by helping reduce metabolic acidosis. For seniors with impaired kidney function, that's a game changer. Now, does that mean everyone should start gulping down baking soda in the morning? Absolutely not. Here's what I tell my own patients. Moderation and medical context are everything. Alkalizing your body doesn't mean chasing some extreme number on a pH strip. It means giving your kidneys a little extra help when they're overwhelmed by too much acid load from diet, medications, or age-related decline. Personally, I use baking soda just once a week. Half a teaspoon dissolved in a large glass of water, sipped slowly in the evening. It's gentle, effective, and costs less than a nickel. But even more important than cost is caution. Baking soda is high in sodium, and if you have high blood pressure, heart failure, or are on sodium-restricted diets, talk to your doctor first. That said, when used wisely, baking soda isn't just a pantry item. It's a quiet ally in your body's balancing act. Let's move to number 2. If you've ever brushed your teeth with a little baking soda, you already know how smooth they feel afterward. But what you might not know is how deeply science backs up this simple practice. Baking soda isn't just an old-fashioned remedy passed down by our grandparents. It's a legitimate, clinically proven ally in oral health. And it might just help you keep your natural teeth well into your 80s or beyond. A 2008 study published in the Journal of Clinical Dentistry found that toothpaste containing baking soda was significantly more effective at removing plaque and whitening teeth than standard formulations. Why? It all comes down to baking soda's mild abrasiveness and its natural alkalinity. It scrubs without stripping, and it neutralizes acids that would otherwise feed the bacteria responsible for tooth decay, gum inflammation, and bad breath. But the story gets even better. Because it shifts the pH of your mouth away from acidic, baking soda actually slows down the growth of cavity-causing bacteria. That means fewer dentist visits, fewer fillings, and more money saved, all from a substance that costs pennies. Now let me pause here for a reality check. I've seen patients go overboard, scrubbing hard every day with straight baking soda, and end up with enamel wear. Don't do that. Use it wisely. 2 to 3 times a week, mixed with a little water or applied gently with a soft toothbrush, is usually more than enough to see results without damage. And here's something I do personally. I keep a small jar of baking soda in my bathroom cabinet. Not as a replacement for toothpaste, but as a complement, especially after drinking coffee or tea. A quick rinse or brush helps brighten your smile, freshen your breath, and restore balance. It's a small daily ritual with a big long-term payoff. Let's move to number 3. Heartburn. That burning, rising discomfort that turns a lovely meal into a long night of regret. For many seniors, it's a daily nuisance. For others, it can be so severe it mimics a heart attack. And while antacids and proton pump inhibitors dominate the pharmacy aisles, there's one incredibly simple, affordable solution that's been quietly helping people for over a century. Baking soda. When you mix just half a teaspoon of baking soda in a glass of water and sip it slowly, you're performing a classic acid-base neutralization. Baking soda, or sodium bicarbonate, is alkaline. Stomach acid is highly acidic. When the two meet, they neutralize. The result? That searing sensation in your chest begins to fade within minutes. But this isn't just folk medicine. According to a review in Gastroenterology and Hepatology, sodium bicarbonate remains one of the fastest-acting antacids available, even acknowledged in medical settings for occasional relief. It's fast, it's accessible, and unlike some prescription meds, it doesn't interfere with long-term calcium or magnesium absorption. Now let's be careful here. Baking soda is not meant for chronic use, especially not in high doses. One of my patients, an 81-year-old man named Carl, used to take it 3 times a day without telling his doctor. He thought more was better, but he ended up with high blood pressure due to the sodium content. That's why moderation and supervision is key. If you're going to try it, I recommend no more than half a teaspoon in a full glass of water, and no more than once a day, and only for short-term use. And if you have kidney issues, high blood pressure, or are on a sodium-restricted diet, talk to your doctor first. Used wisely, this humble powder could save you a trip to the pharmacy, and maybe a sleepless night. Let's move to number 4, because your skin tells the story of your internal health more than you realize. And what's surprising is that baking soda, this humble pantry powder, can become a skin savior, especially for seniors dealing with chronic irritation, fungal infections, or sensitive inflamed areas. You see, as we age, our skin becomes thinner, more fragile, and more reactive to environmental triggers. That's why conditions like athlete's foot, ringworm, and underbreast rashes become more persistent and harder to treat. But when used properly, baking soda can create an alkaline environment that makes it incredibly difficult for fungi to thrive. The evidence isn't just anecdotal. A clinical study published in Mycopathologia found that a 1% baking soda solution inhibited the growth of 80% of fungal strains tested in the lab. That's significant. It means that soaking your feet or applying a paste to itchy, flaky spots doesn't just soothe. It may actually reduce fungal growth at the root level. One woman I remember well, Elaine, age 77, had been battling a stubborn fungal rash between her toes for months. Over-the-counter creams gave her little relief, and the skin kept cracking. After soaking her feet every evening in a warm basin with 2 tablespoons of baking soda for 1 week, the redness reduced dramatically. 2 weeks in, it was gone. Completely. Now, is this a replacement for antifungal medications in serious cases? No. But for mild cases, early symptoms or maintenance, it's safe, gentle, and shockingly effective. Just be sure to dry the area thoroughly afterward, as moisture is a fungus's best friend. But don't go anywhere yet, because while we're on the topic of infections, there's another deeply uncomfortable issue baking soda may help with. And this one affects millions, especially women. Let's move to number 5. Because if you've ever experienced the burning, urgent discomfort of a urinary tract infection, you know how quickly it can derail your day or your week. And while antibiotics are the gold standard for treatment, many seniors are searching for gentle ways to ease symptoms and prevent recurring infections. That's where baking soda enters the picture. Not as a cure, but as a potential supportive remedy backed by both science and experience. You see, a UTI thrives in an acidic environment. When the urine becomes too acidic, the irritation intensifies, and the bacteria that cause infections may multiply more easily. Baking soda, when used wisely and in very small doses, can help neutralize that acidity and make the environment less hospitable for these microbes. In fact, a small study published in the Japanese Journal of Urology followed 33 women with recurring UTIs. After adding sodium bicarbonate to their care plan, many reported reduced burning and urgency within 4 weeks. The researchers noted that the baking soda likely raised urinary pH, giving the body a better chance to fight off infection naturally. Now, let me be very clear here. This isn't a replacement for medical treatment. If you suspect a UTI, always talk to your doctor. But I've seen firsthand how a half teaspoon of baking soda in a glass of water, sipped slowly, can offer temporary relief, especially when waiting for antibiotics to kick in. I've personally used this approach with older patients in nursing homes who struggle with recurrent UTIs, and in many cases, it helped reduce nighttime discomfort significantly. But with great potential comes responsibility. Too much baking soda can lead to electrolyte imbalances or raise blood pressure due to its sodium content. So never exceed more than a half teaspoon per dose, and don't repeat it more than once or twice per day, and never for more than 3 days without guidance. Ready for something even more irritating? Literally? Let's move to number 6. Because when something as small as a mouth ulcer can make eating, talking, or even smiling painful, you know it's time to find relief fast. Canker sores may be tiny, but they can cause outsized discomfort, especially for older adults whose tissues are already more sensitive. That's where baking soda quietly shines, offering a simple, affordable, and science-supported solution. These small, shallow sores often appear due to stress, minor injuries inside the mouth, or reactions to certain foods. And while most people turn to gels or mouth rinses from the pharmacy, many overlook the power of a baking soda rinse. Why does it work so well? Because baking soda or sodium bicarbonate is both mildly antiseptic and pH balancing. It neutralizes acids in the mouth that worsen irritation and slow healing, creating a more soothing environment for recovery. One study published in the Journal of the American Dental Association found that a baking soda rinse significantly reduced pain and shortened healing time in patients with recurrent canker sores. Researchers credited this to its ability to reduce bacterial load and inflammation, without the harshness of many commercial treatments. Here's what I often recommend to patients. Mix half a teaspoon of baking soda in a small glass of warm water, rinse your mouth gently for 30 seconds, and repeat 2 to 3 times a day. I've seen this method bring noticeable relief within just a few days. And unlike some medicated gels, there's no burning or stinging sensation. In fact, one of my patients, a retired teacher in her 70s, told me this rinse was the only thing that ever truly soothed her recurring mouth ulcers. She now keeps a small jar of baking soda right next to her toothbrush, just in case. But the benefits don't stop at your mouth. What if I told you baking soda could actually help you push through your next walk, workout, or morning stretch? Let's move to number 7, because the next benefit might surprise you, especially if you've ever struggled with stamina or muscle fatigue during exercise. Yes, baking soda isn't just for brushing or balancing pH. It's quietly become a performance enhancer for both elite athletes and everyday seniors looking to stay active longer and recover faster. Here's what's happening inside your body. During high-intensity activity or even moderate movement in older adults, your muscles begin producing lactic acid. This lactic acid lowers your muscle pH, making the environment more acidic, which causes that familiar burning sensation and leads to quicker fatigue. Baking soda, as a natural buffer, helps neutralize this acid, delaying muscle fatigue and allowing for longer, more comfortable movement. A meta-analysis in the Journal of Strength and Conditioning Research examined numerous trials and concluded that sodium bicarbonate supplementation significantly improved performance in short, intense activities. Think walking uphill, stair climbing, light resistance training, or even water aerobics for seniors. It helped delay fatigue and boosted endurance across multiple age groups. Now, this doesn't mean you need to chug baking soda before every morning walk. In my clinical practice, I suggest starting slowly. Try mixing half teaspoon of baking soda in water and sipping it about 60 to 90 minutes before any planned physical activity. Always check with your doctor first, especially if you have kidney, heart, or blood pressure concerns, since baking soda contains sodium. I remember a 71-year-old client, Tom, who told me he hadn't been able to finish his Tai Chi class without sitting down halfway through. After learning about this method, he incorporated a mild baking soda tonic before class, and within 2 weeks, he noticed significantly less muscle burn and more energy from start to finish. He was skeptical at first, but now he swears by it. But even if exercise isn't your biggest challenge, what about something as serious and silent as kidney decline? Let's move to number 8. Because if you or someone you love has ever been warned about early kidney trouble, this next use of baking soda might be one of the most important on the list. Chronic kidney disease, or CKD, affects nearly 1 in 7 adults over 60. And one of its hidden dangers is something called metabolic acidosis, a condition where your kidneys can no longer remove enough acid from your blood. This acid buildup can speed up kidney damage, sap your energy, and make your bones weaker. But here's the twist. Baking soda, also known as sodium bicarbonate, has shown real promise in slowing down this process. A groundbreaking study published in the Journal of the American Society of Nephrology followed patients with advanced CKD. The group that received daily low-dose baking soda supplements had a slower rate of kidney function decline and were significantly less likely to require dialysis. Their bicarbonate levels improved, inflammation markers decreased, and many reported better energy levels and appetite. Now, let's be clear. This doesn't mean everyone with CKD should start drinking baking soda water. The key here is medical supervision. Because while baking soda helps buffer excess acid, it also contains sodium, which can raise blood pressure or cause fluid retention in sensitive individuals. But in the right hands, for the right patient, it can be a low-cost, low-risk tool to preserve kidney function longer. I remember one patient, Maria, 69, who was terrified of ending up on dialysis like her older brother. Her nephrologist suggested a baking soda protocol under monitoring. 6 months in, her GFR decline had slowed, and for the first time in years, her labs showed stability instead of slide. It's a powerful reminder. Sometimes the best support isn't found in a hospital, it's hiding in your kitchen cabinet. But we're not done yet. Let's move to number 9, because if you've ever struggled with joint pain, stiffness, or swelling, especially as you age, you might be surprised to learn that baking soda could offer more than temporary relief. In fact, researchers are now beginning to understand how this simple compound can influence inflammation, not just on the surface, but deep within your immune system. A pivotal 2018 study published in the Journal of Immunology explored the effects of daily baking soda intake on inflammation. What they found was remarkable. When a small amount of baking soda was ingested daily, it appeared to shift the activity of the immune system, away from aggressive inflammatory responses and toward a calmer, more regulatory state. In simple terms, it helped cool down the body's inflammatory engine. This has big implications for people living with autoimmune conditions like rheumatoid arthritis, where the immune system mistakenly attacks joint tissue. In the study, both human and animal subjects showed lower levels of pro-inflammatory markers after baking soda use. Their immune cells were literally reprogrammed to be less reactive, less damaging. Now, don't get the wrong idea. This doesn't mean baking soda is a cure for arthritis. It's not a replacement for medication or physical therapy. But it could be a gentle tool to add to your wellness routine, especially if used under medical guidance. I often suggest patients with mild symptoms try half a teaspoon in water every other day for a few weeks, tracking how they feel and watching their lab work closely. And let me be honest, I used to be skeptical about these claims. But after watching a 74-year-old patient named Glenn go from barely able to open a jar to gardening again after 3 months of integrating this practice, alongside diet and movement, I pay attention now. His CRP levels dropped, and so did his daily ibuprofen use. That's the beauty of real, evidence-based natural support. It's not magic, it's cellular. Let's keep going. Let's move to number 10, because when it comes to managing a painful and stubborn condition like gout, even doctors are beginning to look at baking soda through a new lens. Gout, as you may know, is a type of inflammatory arthritis that's caused by a buildup of uric acid in the blood. When this acid crystallizes in the joints, especially the big toe, it creates excruciating pain and swelling. And while medications exist, not everyone tolerates them well, especially seniors with kidney or digestive issues. Here's where baking soda enters the picture. Thanks to its alkalizing properties, baking soda can help neutralize excess uric acid in the blood. A more alkaline environment makes it harder for uric acid crystals to form, and that's the crux of its role in gout prevention and symptom relief. A study published in Arthritis and Rheumatism explored the use of alkalinizing agents like sodium bicarbonate and found that they can help dissolve uric acid crystals and promote excretion through urine. This means fewer flare-ups and less inflammation over time. And again, I've seen this firsthand. One of my patients, Donald, age 77, had been battling gout for over a decade. Prescription medications upset his stomach, so he was desperate for alternatives. After reviewing the research and ruling out contraindications, we introduced a small dose of baking soda, just half teaspoon in water, twice a day during flare-ups. Within weeks, his attacks became less frequent and far less severe. His uric acid levels gradually improved, but caution is key here. Baking soda contains sodium, which means it's not appropriate for people with uncontrolled hypertension or heart failure. Always talk to your doctor first. Used correctly, though, it can be a safe, gentle way to support a healthier internal environment. Let's keep going, because the next benefit may surprise you. Let's move to number 11. Because what if I told you a simple glass of warm water with baking soda could make your next cold or flu less miserable? Colds and respiratory infections may seem routine, but for seniors, they can quickly become serious. Baking soda, though it's no replacement for medicine or vaccines, has long been used as a natural support tool for managing symptoms. The key lies in its ability to break down mucus, soothe sore throats, and make your body less inviting to invading microbes. Here's how it works. When you gargle with a baking soda solution, about half a teaspoon dissolved in a glass of warm water, it raises the pH in your mouth and throat. This creates a less acidic environment, making it harder for viruses and bacteria to thrive. It also helps to reduce inflammation and irritation in the mucous membranes. In fact, a study published in the Journal of the American Dental Association found that regular gargling with a sodium bicarbonate rinse reduced microbial load and throat discomfort in patients suffering from upper respiratory infections. It's a simple, science-backed ritual that costs almost nothing and yet can bring genuine comfort. I use it myself when I feel that telltale scratch in the back of my throat. One rinse in the morning, one before bed. It's fast, soothing, and a great way to support the body's natural defenses. You can also use baking soda in a nasal rinse, combined with sterile saline, to help clear congestion. Just be sure to follow safe preparation guidelines, especially when using neti pots or sinus irrigation systems. A pinch of baking soda in that solution helps balance the pH, making it gentler on your sinuses. The bottom line? It's not about fighting off illness with brute force. It's about creating an internal terrain that favors healing. And this tiny step can go a long way toward recovery. Let's move to number 12, because this next one just might surprise you the most. Baking soda as a potential ally in cancer care. Now, to be crystal clear, baking soda is not a cure for cancer. But what's fascinating is how scientists are exploring its unique properties to support existing treatments. Cancer cells tend to thrive in acidic environments, and some researchers believe that by slightly raising the pH around these tumors, we may disrupt their growth and make them more sensitive to traditional therapies, like chemotherapy. A landmark study published in Cancer Research in 2009 tested this idea in mice. Researchers injected sodium bicarbonate into animals with metastatic breast cancer. The result? A measurable reduction in tumor acidity and slower cancer progression. Even more strikingly, the altered pH made the tumors more vulnerable to chemo. That finding sparked a wave of interest in using alkalinizing agents, like baking soda, not to replace conventional treatments, but to enhance their impact. More recent work continues to investigate this possibility. A review in Trends in Cancer pointed out that tumor acidity isn't just a side effect. It may actively shield cancer cells from immune detection and therapy. In that context, using baking soda as a pH modulator has intriguing potential. Of course, we're still in the early stages. Most of this data comes from animal studies or preclinical models. Human trials are limited and cautious, for good reason. The body's acid-base balance is delicate. Overcorrecting with too much bicarbonate could do more harm than good, especially for those with kidney or heart issues. But under careful medical guidance, some patients are experimenting with small doses of baking soda to reduce treatment side effects or increase comfort. It's a reminder that healing isn't always about adding more medications. It's sometimes about creating the right internal environment for your body to respond better to what it's already doing. Personally, I've spoken to a few patients and caregivers who've shared their experience using baking soda in this way, not as a cure, but as a complement. The key word here is support. Let's move to number 13, because sometimes the smallest comfort can bring the biggest relief. Especially when it comes to something as personal as body odor. You might be surprised to learn that baking soda, that same humble powder you use for cookies and cleaning, also works as an incredibly effective natural deodorant. For many seniors, especially those with sensitive skin or concerns about chemicals in commercial products, this can be a game changer. Here's why it works so well. Sweat itself doesn't actually smell. It's the bacteria on your skin breaking down sweat that creates odor. Baking soda is alkaline, which means it can neutralize the acidic byproducts of that bacterial breakdown. It also absorbs moisture, helping to keep you dry throughout the day. That's a powerful 1-2 punch against odor. In fact, a study published in the Journal of Cosmetic Dermatology confirmed that sodium bicarbonate significantly reduced underarm odor when applied topically. The researchers attributed this to its ability to balance skin pH and reduce the presence of odor-causing bacteria. And for those concerned about chemicals like parabens, aluminum, or synthetic fragrances in store-bought deodorants, baking soda offers a clean, fragrance-free, cost-effective alternative. It's especially ideal for seniors who may be more prone to skin irritation or allergic reactions. Application is simple. Just pat a small amount under clean, dry arms. Some people mix it with a bit of coconut oil or cornstarch for added gentleness. Others apply it directly, using a powder puff or even just their fingertips. Either way, you're using a product that's safe, natural, and supported by science. Personally, I've recommended it to patients who've had reactions to traditional deodorants, and many of them have never looked back. One woman in her late 70s told me it made her feel confident again, especially during community events and family gatherings, something she hadn't felt in years. And that's the heart of this conversation. We're not just talking about skin or smell, we're talking about dignity, confidence, and well-being. So whether it's for detox, pain relief, or daily freshness, baking soda proves again and again that some of the most powerful solutions don't come in fancy packaging or expensive prescriptions. They come from understanding, wisdom, and using what's already right in front of us wisely. If you've tried baking soda for any of these remedies, I'd love to hear about it. Share your story in the comments, and if you learned something new today, don't forget to like this video and subscribe for more practical, science-backed health tips designed with seniors in mind. Because sometimes the simplest things are the most powerful. Let's move on to the conclusion. Because after uncovering 13 powerful uses of baking soda and one vital safety section, it's time to bring it all home. From detox and digestion to arthritis relief and natural deodorant, this tiny white powder continues to prove it's one of the most versatile, underrated tools for health, especially for older adults who are looking for simple, affordable, and effective solutions. We've seen how baking soda helps with oral hygiene, skin irritation, kidney support, joint pain, and even enhancing exercise performance. But perhaps the most important takeaway is this: don't underestimate what's hiding in your kitchen cupboard. Sometimes the best remedies don't come in glossy boxes. They come from generations of wisdom confirmed by modern science. If you learned something new today, comment below with the words baking power to let me know you're here and growing with us. I read every message, and I'd love to hear which use surprised you the most, or which one you plan to try first. And if you found this video helpful, please take a moment to subscribe to Be Healthy Seniors. Every week, we dive into natural remedies, medical insights, and practical tips to help you live stronger, longer, and with more confidence. Because at the end of the day, it's not just about saving money, it's about reclaiming your health on your terms.